you, Dr. Angida and Sahani sir. Good evening, good afternoon, and good morning. This is the 1496th day of continuous webinar conducted by International Forum for Promoting Homeopathy. We welcome all to this session, and today our guest is Professor Muktinder Singh. And let us begin the session with 1 minute silent prayer. Thank you all. As you all know, the International Forum for Promoting Homeopathy comprises of homeopathic lovers, students, and homeopathic doctors. And we have 3 sessions every day. And the first session is already over by just a few minutes, seconds away. That was our Hindi session from 7 to 8 and 8 to 9, the international session in English, and 9 to 10, the local language session in Malayalam. And we are about to reach our 1,400 day on the July 1st, and we will have a celebration on the time. And today we are very lucky to have a wonderful guest in Professor Dr. Muktinder Singh. Sir has completed his MD in homeopathy and is the chief physician at Effective Homeopathy near Krishnan Mandir, Ludhiana, Punjab. And Sir has a professional experience. She has a professional experience in dealing with pediatric cases, behavioral therapies, and autoimmune disorders, and advanced pathological cases. And Sir has a clinical experience of 25 years and practicing since 1992, and is working already have a teaching experience of 25 years and working as a professor and HOD in the repertory department of Sri Guru Nanak, the Homeopathic Medical College and Hospital, Ludhiana. And Sir has made so many presentations in different parts of the world and is a guest faculty at London College of Homeopathy, UK, and has there always associated with the Ayush Homeopathy, and has organized 2-day seminars for Dr. Scholars in Patiala, the chairman of scientific committee, and so many posts he held is having, and he has an experience in different field, particularly as a speaker. He is usually there, a most wanted personality at the international seminars and this in different part of the world. And he is a winner of many awards, and he is a resource person of Kent Memorial Lectures held in NHMC, New Delhi. And so many things, there are so many things to add. He has achieved so many awards also. A Lifetime Achievement Award by a Delhi Board of Homeopathy, an award of the Best Motivational Speaker by Sahib Trust, and founder, director, Effective Homeopathy, Homeopathy Care, and trained in pediatric, especially running clinics in across India. And Mazhar is an achiever of Dr. B.S. Chowdhury recipient Lifetime Award. So many awards winning is a lot of time required to mention about all those things. Today, Dr. Muktinder Singh will be discussing about emotional caution, homeopathic perspective, repertorial, and materia medica with the cases. Sir has presented so many cases in the previous editions of the sessions also. So let us proudly welcome our guest of the day, Dr. Muktinder Singh. Welcome, sir.
Thank you, Doctor, for introducing me to this august presence, august speaking. So I feel privileged to be part of this IFPH talks. I have been here earlier also for my pair of presentations on anxiety salvation. So today, I really thank the IFPH for trusting me for this presentation, and especially Dr. Sani sir for blessing me and giving me this honor and finding me capable of presenting here. So I would start sharing screen. I'm having an apology from all of you in advance that today my presentation got corrupted. So my graphics and videos, they might not be working efficiently today, but I'll try to make it possible that I make the subjects transfer to your brains.
Uh,
So today's my topic is on emotional quotient homeopathic perspective. Am I audible, sir?
Yes, sir, we can see you and we can clearly see the uh, uh, PPT also. So no problem, sir. Your talk itself will be a beauty to hear. So no problem. You can,
So my topic today is coming directly to, thank you, doctor. My topic is emotional quotient because as we talk of IQ, intelligent quotient, same way these days, the big trouble because of rise in psychosomatic disorders. This emotional intelligence is also one of the subject we need to learn. So according to sources, emotional quotient is the ability to understand, use and manage your own emotions in positive way, to relieve stress, communicate effectively, empathize with other, overcome challenges and diffuse conflicts. This is what our life is. We are not bodies. We govern our bodies. We use our bodies as a tool to live and to represent our soul, inner self into this world. And emotions are the actual language. See, language is not English, Hindi, Punjabi, Urdu, Russian, Persian. No, these are the regional ways of presenting ourselves, and these are regional languages. But the real language we speak on as a child when he's born, he communicates us with eye contact. He communicates us with smile. He communicates us with the cry. He communicates with the face expressions, the body language. So 87% of our communication based upon the non-verbal communication. So languages are verbal for verbal communication. But we communicate this world, we live in this world within ourselves and outside on the strong foundation of emotional life. So we have an emotional personality and a physical constitution. So if we start understanding our own emotional personality along with the people around us, their emotional side, so whatever comes into our life as a difficulty, we can disperse it very easily. So what are the aspects? Means, first of all, whenever we are in stress, there is some or other emotion, hatred, anger, stress, fear, worry, or some jealousy, or some affection, some sexuality. There is something behind which is making us stressed. And if we are able to communicate our stress, our emotions effectively, and empathize with other, I know what I am thinking, but I want others to understand what I am thinking. But the person who is emotionally balanced is able to understand his own emotions and empathize others' emotion. What is empathy? One is sympathy, other is empathy. Sympathy is if someone in my friend, in my life is suffering from something. So I sympathize with other, means I feel his pain, sympathetic. So I feel if you are in pain, I am in pain. This is sympathy. But if I'm able to understand your pain, if you are angry, I'm angry. This is sympathy. But if I'm able to understand your anger, why you are getting angry, what is making you angry, what is the behind? So that is called empathy. Empathy is beyond sympathy. Empathy is not just sympathizing. It is empathizing, means I understand, I put my shoe in your foot. I put my foot in your shoe. I sit at your seat and understand. So when I empathize with other, I'm only then I can solve the conflicts. So overcome challenges and diffuse conflicts. So if I know what other person wants, if other person want to be listened, if I understand this, I listen to him and the problem will be solved. Then some emotional symptoms can also be related to medication also. Say if someone is taking antihypertensives, anti-epileptic, and say Alprax or and mood stabilizers, OCD patients, psychiatric patients. So their symptoms can be so much masked that they may be due to the medication. So medication and substances can directly affect the nervous system and thus can cause emotional symptoms. As if someone is having suicidal thoughts, so we can mask those symptoms by giving dopamine or androgens. But if someone is getting a medicine for pimples, say, so the medicine hormonal, the medicines given for pimples cause suicidal thoughts. So this medicine, one medicine is creating that thoughts, other medicine is evading that thoughts. So there are many medicines which cause mood swings. There are many medicines which cause depression of spirit. There are many medicines as we see in Parkinson disease and medication, dopamine, or the medicine being taken for the Syndopa, the medicine which is given for Parkinson. It makes the person's face totally impressionless. So it kills all the impressions. So there are medicine which can affect our body language, which can affect our facial expressions, which can just manipulate or maneuver our mood, our emotions, our feelings. So medical conditions such as dementia contribute to emotional symptoms by damaging brain tissue. The link between emotional symptom and chronic medical conditions such as cancer, say someone is diagnosed with the cancer or someone in the family is diagnosed with the cancer, it will deeply affect the mood of whole family and the person. The diabetes affects our libido, our sexual life. Heart disease makes you depressed, or so HIV, AIDS, chronic pain disorder. So all these symptoms, there are a number of which have direct effect on our emotions. So what is mood? As I've been talking that there is a lot of effect on the mood of a person. So what actually mood is? Mood is defined as pervasive and sustained feeling tone that is endured internally and which impacts nearly all aspects of person's behavior in the external world. So it is pervasive and sustained feeling tone. My mood, if I'm cheerful, a lachesis patient, its mood is pervasive and sustained feeling which endure internal and which impacts nearly all aspects of person's behavior in external world. Why a morose remedy like ammonium mure, a morose remedy like natramure, a morose remedy like sepia. So their mood without any cause would be overpowered by that remedy. So mood is one thing which is, so we say that today my mood is good, today my mood is bad, but my mood is changeable. So there is good mood, there is a bad mood, there is a changeable mood. So there is no mood also. So their mood is a deep person's behaviors to the external world. So many aspects are affected by our mood. So mood disorder, what are mood disorders? So these disorders also called affective disorder, mood affective disorder, involve persistent feelings of sadness or periods of feeling overly happy or fluctuations from extreme happiness to extreme sadness. So what are mood disorders? They are called affective disorders. What they involve, say someone is feeling sad for a long period or feeling overly happy. And in homeopathic repertory and materia medica, we get so many of rubrics and materia medica symptoms or proving symptom. So, or fluctuation from extreme happiness to extreme sadness, as we see in Crocus sativa. First moment, the person is very happy, very affectionate, very joyous. Another moment, he suddenly gets anger and it goes into the rage. And in that rage, he can even kill someone. Same way, Lysin. In one aspect, he gets angry on trifle. He just damages everything. So it's written in the literature that he will just break through his own walls and roof. And then after some moments, he'll start repairing what he has damaged. Same way, Ignatia is big mood swinger. So one moment is good, normal, another moment is so hysterically affected by the mood. So we have many medicines. So most common mood disorder are depression, bipolar disorder, and cyclothymic disorder. So what are the difference between depression? So this is not my topic. So in bipolar, the difference of mood or the hypomania or hypermania phases, they are long. Say for few months, the person is in hypomania, and for for another few months, he is very hyper. So one is low phase, one is high phase mood. But in cyclothymic disorder, what happens is these mood swings, they are short-lived. Say in the morning, he has one mood, in the evening, few moments back, he has one mood, and few moments. This is cyclothymic. When alteration of mood, alteration symptoms, they are very quickly following each other. So that is called cyclothymic disorder. So when emotional disorders such as anxiety, depression, they coexist with physical illness, then quality of life suffers and outcome for treatment worsens. So the routine management of neurological conditions should therefore include assessment for treatment of disorder. So when we are taking the case, we should not just take the symptoms, we should evaluate the whole condition. So another term which I will use today is emotional lability. So emotional lability is a neurological condition that causes uncontrollable laughing or uncontrollable crying, often at inappropriate time. Say, if I'm happy, I remember one of a lady who was brought to me for migraine, and while taking case, what her sister-in-law told, that she is unfit for society. What happened? So I asked you, what happened? Why she is unfit for society? We cannot carry her to a cremation. We cannot carry her to a family where there is someone has died and there is that kind of condition. Why? That's why you never know. She will start laughing and laughing so loudly that all are crying and she'll be alone laughing. On other instances, if we go to the marriage, you never know. She's so unpredictable. If she start weeping, she will cry as if someone has died. So inappropriate time, laughing or crying at inappropriate time, it tends to affect people with pre-existing neurological condition or illness. So this is one aspect, that this is not just a mood disorder. There is something neurological cooking in the mind. There is some pathology which is there. So you must investigate and take out that. I recently got a case where there are microadenoma of the pituitary. The prolactin levels get affected, and the lady is crying all the day, crying without any cause. So one symptom we have involuntary crying. So that lady is crying day and night. So her prolactin levels are disturbed. So that is neuroendocrinal disorder. So this emotional lability has many other names like pathological laughing and crying, pseudobulbar effect, PSA, and PBA, sorry, affective lability, emotionalism, emotional incontinence, involuntary emotional expression disorder. So these are the other names. What is emotional lability? Is the main symptom of emotional lability are uncontrollable outburst of crying or laughing. So these outbursts are usually an exaggerated or inappropriated intense emotional reaction. They can also be completely unrelated to your current emotional state. For example, you might start laughing uncontrollably when you are upset. So supposing I have a boy is suffering from chronic myalgia. He's bedridden. And when I was talking, so when I was talking, so our mother told that when he is in extreme pain, his reaction is he starts laughing. So involuntary laughing. This laughing is uncontrollable. So this was the symptom for me to be pondered over, that in pain, you see people crying, but in extreme pain, you won't see people laugh. So this, once I got a one of my police inspector was there. So he said that I have seen people when we torture them. So when they torture the people, and then I have seen some people, so we got frightened. So it was a time of militancy that we were about to kill that person, and he was laughing like, and we got frightened and we left him. So we torture some person and they start laughing. So this kind of effect. So this is when your emotions, they have surpassed the limit of tolerance. So for example, you might start laughing uncontrollable. There are many medicine which I'll be discussing. So this kind of, say, for you, laughing cannot be a disease. Many people, I presented this presentation somewhere and people started asking me how happiness and laughing can be a complaint. So, but in diagnostic criteria, ICD, International Classification of Disease 10. So this R 45.864, 5.86 is the code. It is a billable ICD-10 code that can be used to indicate a diagnosis for reimbursement, emotional lability. So I would like you to see this video. Are you able to see the video? Is this video audible and watchable? Hello? 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 Can anyone acknowledge? Right. So these are the friends who have got a get together, and one of them, you see the person who has started laughing.
Sir, audio is not working, but
But you can see what they are doing. They are laughing.
yes.
So what is observation? This boy started laughing normally, but his laughing was to such an extent that it caused his spasms in the abdomen. And this, what if, can you imagine if this situation leads to such a situation that he has to be hospitalized? So can laughing be a disease? Laughing disorders, also known as pseudobulbar effect, is a condition that causes random outbursts of laughing or crying. This can be disrupting and embarrassing for both the individuals with its and their families. So many people who experience this condition start to avoid social situation and isolate themselves from others. So I'll give you a case here. So what is actually PBA? It's an uncontrollable crying or laughing that is above the expected response to the emotion felt or situation. So when there is a trigger, it's smaller, but it leads to extravagant reaction to the situation. So the feeling experienced internally is significantly less than the level expressed outwardly and difficult to control. So when your laughter or your crying or your emotions internally, they are not such powerful, but their external manifestation, their presentation becomes so powerful that it overpowers the amount of basic emotion. So the expressed emotion or laughter or crying could also be the opposite of the feeling such a. And another that possibility is that you are feeling sad, but you are laughing. You are feeling happy, but you are crying. So when this goes out of proportion, when this goes out of context to the situation, so symptoms are out of individual's control and are difficult or impossible to consciously stop. This is underdiagnosed because the symptoms are typically underreported. So usually people, they don't they report to the physicians that, okay, they feel that, is it a problem? No, it is not a problem. This is normal. So someone feels it more, but someone feels it bad. So I was never thinking of this as a disease in my practice also. But later on, I'll share you some cases where I came to know that how serious this can be. So when symptoms are reported, it can be often be misdiagnosed for other mood disorder like bipolar, depression, or cyclothymic. So the exact cause of PBA is still unknown. PBA is pseudobulbar effect. It has been associated with condition affecting the brain and neurological symptoms. So this is the reference. So condition often associated with PBA: dementia, Alzheimer's, Lou Gehrig's disease, or amyotrophic lateral sclerosis. I have a patient of ALS and multiple sclerosis, epilepsy or seizure disorder, Parkinson's disease, I have already mentioned, traumatic brain injuries, strokes. So here the effect of emotions goes unproportionate. So two of standardized questionnaire used to diagnose PBR. I'm not touching this, but for this, the pathological laughter and crying scale and Center for Neurological Study Lability Scale. So there are scales where you can self-evaluate or evaluate the patients and evaluate the follow-up of the patients. So another medical condition, I'll show you this.
For the parents you're about to meet, the sound of their child's laughter is an alarm bell, filling them with dread and fear because their giggle fits are actually the uncontrollable symptoms of a very rare brain disease. Tonight, a few doctors with a revolutionary treatment are determined to change that. Here is ABC's Deborah Roberts.
Adorable, priceless. For any parent, it's a treasured and joyous sound, their child's laughter. But for a rare number of children, laughter can signal a heartbreaking future.
The giggling when he was young was such an endearing type of a giggle until we realized he was giggling at inappropriate times.
9-year-old Keegan Dysart's parents, Robin and Chris, say the mysterious giggle began when he was just a toddler.
You thought what?
He's in his own little world. He's enjoying himself.
What's wrong with giggling?
Something was wrong. A neurologist said Keegan's bizarre laughter wasn't funny at all, but potentially dangerous. He was having gelastic seizures.
Well, I couldn't understand how they could call these seizures. He's not convulsing. He's not on the floor. Like everybody thinks of a seizure.
Keegan was diagnosed with a form of epilepsy called hypothalamic hamartoma. He's not alone. In Toronto, 7-year-old Matteo Rocha is hit by laughing seizures up to 6 times a day. MRI scans reveal the cause for both boys, a small non-cancerous lesion buried deep inside their brains.
No, don't do that.
Now, for 2 families, it's a race against time to find a cure, because untreated, the laughing seizures can cause long-term brain damage. For years, the only hope was invasive high-risk brains.
So I have a real patient video, but due to some personal reasons, the patient has not allowed me to show. So one of my patients, or rather many patients, if you see a Bufo patient, you see hyocemus patients, belladonna patients, aurum patients, they sometimes, well, on the series, when you are asking about them pain, so they have a little laugh along with, they giggle along with. But I have epileptic patients also where this laughing is so convulsive that they are not actually laughing, but their faces expression shows as if they are laughing. So if we go to the homeopathic perspective, I'll start it with the case. So a young girl was admitted to hospital twice for uncontrollable laughter. So this was my patient. They were my known family. They said, you know, doctor, our daughter, she's almost of my daughter's age. So we have to admit her twice for the some complaint. So what I asked, okay, what was the complaint? She said that she started laughing, and laughing. She got fainted. The first episode occurred when her elder sister was about to take a flight for Canada, study visa, a day after. They had family gathering, part and functions at home. She was very, very happy. After the function, where all cousins were sitting together at night, chilling and having fun, merry and feast mood, she started laughing and was continuously laughing for almost an hour. So when the other cousins, they noticed it, that see, that was a laugh. The situation is over now. Everyone has stopped. They are talking serious or they are laughing on other things. They noticed that this girl is still laughing and crying for help, that I cannot stop my laughter. She started laughing and was continuously laughing for hours. This laughter spasm in abdomen caused spasm in abdomen and she almost fainted partially. So this, she started holding her tummy and she almost got semi-conscious with this laughter, her lung spasm. So this was a panic in family and they just was to carry her to an emergency. Another episode occurred, which was a day of a college function, and she was admitted to hospital in emergency for 8 hours. When family discussed with me and I took the case, important points were she was happy and joyous on both the incidences. So she was, since her early childhood, it was only twice she was admitted to hospital and both when he was overjoyed. She took some pills. So another common thing which came to my notice was on both this occasion, she had function. One was college function, other was family function. And what this girl did was she took some pills to postpone her menstrual date. So her date of menses were falling on the same day of function. And she said that I got so much of dysmenorrhea and it is so much discomfort. I cannot dance. So I was to perform in college. So she took anticipatory, she took hormonal products to postpone her periods. She was very happy and joyous on those occasions, and both occasions she took these menstrual cycle pills. And on all the occasion, her stomach, abdominal, gastric disorder was there. So here, this first is homeopathy aspect, this disease. This was definitely a PBA, pseudobulbar factor. And she was having along with the hormonal disturbance. So I need a remedy which has effect of suppressed menses because her menses were suppressed both the times. We got sick with emotional excitement. So I need an emotionally excited remedy. and which has effect of emotion on gastric symptom. So any ideas? Any ideas of the remedy? Which has suppressed menses, which has emotional excitement, and emotional excitement affects the gastric system. Can anyone? You can type. Am I not audible? Hello? Hello?
Yes, sir.
Am I audible?
Yes, sir. Clear. Everything clear, sir.
Okay. Can anyone
That's
tell me
why.
the remedy? Pulsatilla, aconite, Artemisia vulgaris,
Yes, yes.
coffea, asphodita, antim crude, Nux moscata. Very good. Dr. Ram Devi Ambe. How you reach to Nux moscata? Dr. Nonita also saying Nux moscata. Why Nux moscata? Why not other remedies? Pulsatilla, why not coffea? Why not the other remedies? Why not Ignatia? Why not Ignatia? Lachesis. Asphodita is a good suggestion. Okay, fainting.
She's
We need a fainting remedy. Yes.
she's went on to a sober
Hmm?
sleep. She went on to deep sleep. That may be the reason.
Nee, but I have not mentioned in history anywhere that she went to the deep sleep. So let us see it from repertorial point of view. So I think I have missed the repertorial sheet. So how, yes, the remedy given was Nux moscata. I was telling that due to some technical reason, I have lost my graphics of this presentation. So please bear with me. Yes, it was Nux moscata. So I can repertorize live, this case live for you. My screen visible?
Sir,
Is it visible?
yes, yes, a repertorial chart before IS.
So we need a remedy where menses were suppressed. So yeah, we have a small rubric also. Menses, mental symptom aggravated after suppressed menses. So we have two remedies, ferrum and Nux moscata. So, but if we take generalities or female symptoms, so ailment from menses suppressed, we have a bigger rubric also. And here also, Nux moscata is one of the major remedies. Then emotion causing gastric disturbance. You say Ignatia is the remedy. So why we preferred Nux moscata over this? So why I preferred, I have lost that repertorization chart, but I will just come back to my presentation. That Nux moscata has a kind of proving symptom. In Nux moscata, the catalepsy occurred in association with sudden emotional reactions such as mirth, anger, fear, or joy. So Nux moscata is one of the remedy which is very much ignored because we hardly take it as a polycrest remedy. But in my practice, I have seen Nux moscata as one of my major survivor in many, say the females, where there is a recent history of these contraceptive pills overuse or Saheli medicine which are taken to ergot or to abort, or there is when there is an induced abortion, or whenever there is postponement of menses, so nux moscata start comes up in the case. So it, as energy levels are fall, there are severe mood swings, and sometimes this, as doctors mentioned, that there is a sleepiness overpowering symptom. So whenever there is any emotion, such as happiness, joy, fear, anger, so an element of surprise seems important. These attacks resemble loss of muscle tone that occur in REM sleep, or to a lesser degree in many persons who become weak with the laughter. For a person with narcolepsy, sleep begins almost immediately with REM sleep instead of with a normal sleep period for 60 to 90 minutes of non-REM sleep. Usually when we fall asleep, so nux moscata is one of the remedy for sleep apnea, one of the remedy for sleep disorders. It's a great remedy for insomnia as well as oversleeping. So usually when a person sleeps, see how rich our literature is. When a person sleeps, it takes almost 60 to 90 minutes to reach to non-REM sleep. But here in nux moscata, the person directly, he sleeps and falls into REM sleep, rapid eye movement sleep. So this is the effect of nux moscata on the sleep centers. The causation listed for nux moscata include anger, emotional excitement, fright, fear, disappointed love, mental exertion, and mental shock. So nux moscata gets ailment from emotions, anger, fright, grief, disappointed love, same as ignatia, mental exertion, mental shock. Although laughing, giggling, and seeing the ridiculous side of everything are frequently mentioned by the provers. So when nux moscata was in the proving, many of the provers, they mentioned this, that they start during proving, they started seeing everything funny. Everything started seeming ridiculous. So frequently they mentioned these symptoms. So these appear to be the more concomitant than causative phenomena. So provers, they have mentioned, and in our literature it is mentioned, that it is more of a PQRS and concomitant like thing, that if a person is having anything, say he's having fever, and he will start looking at everything in a ridiculous way. They'll start making fun. The other remedies which we use in practice for this is Kali iode. So I remember a cancer patient coming to me, a young cancer case coming to me with metastasis and all that. She was a young lady of 34, 35 years. And when I saw her, I saw, who is the patient? She said, I'm the patient. So what, why? So doctors have answered me. The doctors have told me that I'm just the going to live in this world for 3 months only. And see, so I said, you don't seem to be a cancer patient. Well, if I have to die, then why not to die with the joy? So I will celebrate all these 3 months. I'll celebrate. And she was laughing so. So I gave her Kali iode. Recently, I had a patient. She was a child and she was laughing. She was in bad distress. Her lungs were in spasm and she was taking it so lightly. So Kali iode, they take it lightly. And nux moscata, they see everything ridiculous. A cophia patient in acute will start feeling joyous and talk irrelevant. I remember a girl was a 106 temperature and she started, I told her, from where you are coming? She's coming, I'm coming from my school. So my mother told that she was so sick, we have not sent her to school. She said, I went to the school and in the classroom, we have a swimming pool and I bathed there. I took a bath in the swimming pool and my teacher was there and she started laughing. So that is a kind of loquacity and joyousness. So joyousness can be represented as a symptom. I have seen lachesis. Lachesis, they talk a lot. They become so cheerful during sickness. Pyrogen, they talk very fast, but not always joyous, but they talk very fast. Stramonium, they start singing with the joy in acutes. So this is the same way. Nux moscata is one of the remedy which starts seeing ridiculous side of everything. So this is a great concomitant. All these are concomitant. Joy, feeling joyous or feeling cheerful during heat, So that is a concomitant: cheerful, heat during; cheerful, chill during; cheerful, sweat during. So these are the concomitant symptoms. I presume that all of us are quite aware with the concomitants. So Nux moscata, proving Allen Encyclopedia says, felt foolishly happy but could not talk, had no desire to talk, just happy and merry, not even talking to anyone. Everything provokes laughter, quite to habit. This was especially noticeable on going into an open air. He stood still upon the street, made foolish gestures. Between the attacks, he sank into absence of mind, and on collecting himself, everything about him seemed ludicrous. During this, he looked foolish and childish, like an idiot. On being brought into the house, he became somewhat better. So see the proving symptom that he was laughing without any reason. So if we read the other remedies, we'll get this so frequent. So aura of Nux vomica patient, moschata patient may appear unusually lively, bright, happy, laughing, articulate, sensitive, sensual, and amorous. So I see I have been overlooking this remedy into my practice. If someone come to me with this aura, with this kind of vivacity, loquacious, jesting, we usually end up thinking like this is only. We end up thinking few joyous remedies only. But Nux moscata is many a time overlooked. So these are the person who go by feeling, not reason. So these are the people who just go by feeling. So I'm feeling happy. Whether there is a reason to be happy or not a reason to be happy. Emotions, not intellect. So they are governed by emotions. Another remedy is viola odorata. Viola odorata, we have a symptom where we see emotions overpowering the intellect. Although this remedy is not mentioned into the our repertory, that emotions overpowering the intellect. But in our Materia Medica proving rubric, this is written. So emotions predominated by the intellect. So Falcopyrum, Lavafi, Viola odorata, and Valerina. In Murphy repertory, we see Kali Carb, Natramure, Valerina, Viola odorata. In complete repertory, we get this symptom as emotions overpowering intellect, Kali Carb, Plumbum, Valerina, Violator. But Nux moscata is not mentioned anywhere. But in our literature, we get this remedy also. So where we use this rubric is emotions overpowered by intellect. I remember one of the lady, she was having a very tough marriage. Her husband was beating her. Her husband was not cooperating. He was drinking, and her mother-in-law was blaming her on her character and all that. So she had an old friend who was settled into the America, and she always had a dream of settling into the America. She was in her parents' house, and they throw her out in the midnight. Her in-laws, and in the meantime, her old childhood friend, he was around and he saw her suffering, and he offered her a relationship with her. And she was saying that I will carry you to the America. So she was having no child, and it was a golden opportunity for her to fly to America. Even her parents, they agreed. Everything was in her favor. But she suddenly stopped talking to that person. So when she stopped talking to that person, so she suddenly suffered some pathology. She was having some autoimmune disorder, and she suffered badly. And when I took that history, so all history was dating back that it was a golden opportunity to fly away from this permanent pain. And she was having her boyfriend and her family, everyone was supporting, but she thought of that, no, it is my moral duty not to ditch anybody. So I'll choose to suffer the whole night, whole life, rather than flying away. So her intellect was just overlooking her best. So she was taking so I'll not take that decision. So she just took. So this was her strength. And she told that in her life, he has taken this, that she has overlooked emotions and took a logical decision. So these are the people who take logical. So Viola odorata is such a remedy which controls her thoughts so strongly, which controls her emotions so strongly that they are just buried deep into somewhere. So this is one of the special aspect of nux moscata patient, where you get they feeling, not the reason. So they'll go by feeling. Nux moscata is just opposite, that it will not follow the intellect. So violodorata, but nux moscata, they will go by the gut feeling, not by the intellect. Emotions, not intellect. So I've just told you on a contrast option, that where the person will choose the intellect, that is intellect overpowered by emotion, the remedies I have told. But earlier it was my tongue of slip that I told that nux moscata is not listed. I was wrong. My point, what I'm saying is, nux moscata is one of the person who will go with the feelings, like antim-crude. They will go by the feeling. Natrum mure, falling in love with the coachman. So this kind of nux moscata is such an emotional fool, like Ignatia falling in love with the wrong person, that they will not go with the intellect or with the logic. They will go with the emotions. So they live in a world of their own creation. They fantasize things and often absorbed in their personal fantasies and fancies. So this is what the nux moscata is. So these person need to feel loved and appreciated, and like physical contact, like hugging, like phosphorus and holding, and they wither without attention. So they are the kind of clingiest persons of the Materia Medica. There is a tendency to naive and foolish behavior, which is often innocent, but leads them into trouble in relationships. Sometimes their problems start after they suffer grief due to unhappy love. So this is what the nux moscata, Borland Materia Medica says about nux moscata is hysterical, suppressed menstrual patient and pregnancy patient with the mild mental disturbances are liable to get periods in which suddenly everything strikes him as perfectly ludicrous. So they just got with the suppressed menses appear and the person start feeling so much joy. They burst out laughing in hysterical attack of laughter, which are quite likely to go on attack of weeping. So medical condition rapidly in almost incredibly short time change from joy to sorrow, from laughing to weeping. So this we have seen Coffea, Crocus, Nux moscata. So this is one of the most moody remedy of our Materia Medica, where the moods, they just switch over each other and they are out of control. So as in Crocus, this anger is out of control. So when they turn from affection, same in the Coffea, their thoughts are out of control. So other remedies, I think it's the sir. What is time? It's almost 9. So
Yes, sir. Just
we can
5 minutes.
have part 2 of this lecture, because there are a lot of medicine which need to be discussed. So there are many slides which are left. So I think I took more time.
Yes, and anyway, it's is really a very good session, sir. That's why nobody really want to stop you. But since we have only 1 hour, as you told earlier, we can have the second session in July as per your convenience later,
We
sir.
can continue. There is Materia Medica, a lot of Materia Medica, which we can further discuss and we can further connect, because this is such a big thing that many, I have seen young children suffering. So they'll come to, the parents will come that he is sick. So maybe he took cake and pastry and he is sick. But the reason behind comes that on the day of his birthday, he was so happy. So this joy caused the sickness. I remember one of the girl, she started having a lot of pimples on the face. So we have that remedy where ailment from joy. So one of the remedy is that girl was having a lot of pimple after she got engaged. So there was no sufficient reason for, she was not in stress. She was quite happy since she was into that relationship, but suddenly she started getting such a bad face. So if you see these are the remedies which ailment from joy excessive. So she started getting that bad shape of her face after she got engaged. So I took this rubric, ailment from joy excessive, and she started, along with, she started an aversion, she was always liking the milk and strong aversion to the milk and strong aggravation from the sun. The doctor told that it is photophobia. But when I mix this sun aggravation, milk aversion, and ailment from joy. The remedy came to be the natrum carb, and natrum carb cured her everything. So this way, see, sometimes joy can be the cause of your sickness. We usually overlook this fact that how joy can make you sick, but no, start taking into the consideration. If someone is having very happy time of her life and suddenly start getting physical complaints or some emotional complaints, this can be the one with this emotional lability, PBA, can be at the base. So this is my message today. So we'll have another session very soon. So thank you, IFPH, for giving me this opportunity to talk to such a learned people. Thank you.
Definitely, it's a very, very important subject, sir, discuss, and not only that, the Materia Medica you covered are really excellent, and that really give us an input how to differentiate each and remedies one by one. That's the comparative Materia Medica was well discussed. Even your videos worked well in time, sir. There were no problem with your videos, sir. So I invite Dr. Rajwit to say vote of thanks to this session. Doctor, you can unmute and say vote of thanks to the session. Ravjit, Dr. Ravjit, please unmute. If there is any problem, I shall invite Dr. Bob Lim, please.
Hello, Bob.
Dr. Bob Lim.
Bob, speak something.
Yes, Dr. Bob. Please unmute, Bob Lim. And you can say vote of thanks to the session as well as, yes.
Yeah. Thank you very much, because somebody don't allow me to talk. So they mute me. So now they release me. So I'm released from this from talking now. Okay, thank you very much. That was a very good session by Dr. Muktinder Singh, and he's also my guru. And yes, he's not strange to Malaysia. I've visited Malaysia many times. So I hope he will come again to Malaysia. And I'm Bob Lim from Malaysia. And on behalf of the IFPH, I would like to thank Dr. Muktinder Singh for giving us a very informative session on this emotional effect and laughing effect. And also there was a thing of happiness in that, the symptom of happiness and joy and the laughter and the giggleness and all these things we have to differentiate. So it could be a symptom, mental illness that leads to it. And also he has mentioned that certain symptoms might also be related to Parkinson. So I hope that in this next session, he will talk more about the Parkinson-related diseases and how we approach that with homeopathy. And in Malaysia, those mental cases we send to a hospital. We don't call it a mental hospital. We call it the happiness hospital. In our language, we call it hospital bahagia. Bahagia means happiness. So those mental patients we all send to hospital bahagia, happiness hospital. So I think your teaching today has given us a very good insight, and we can take this as a guide as we approach the many cases we have faced today. Sometimes we don't have physical symptoms enough, so we have to rely on the mental symptom. And it is a very good session today. And once again, on behalf of the international IFPH, I would like to say a very big thank you to Dr. Muktinder Singh, Professor Dr. Muktinder Singh, our guru. And thank you very much. Over to you, Dr. Dennis.
Thank you, Dr. Bob. Missing you a lot.
Thank you, Dr. Bob and Dr. Muktinder Singh. So we will have a second part of the same. We will have the second part of the same in the coming month itself as per SARS convenience. So with that, we come to the end of the day 1396. And tomorrow we will have a session from Dr. Ramya Girish, and the subject will be dysmenorrhea in homeopathy, and you can use the same link for tomorrow also. Every day you can join at the 8 p.m. and you can watch the session again by YouTube. Tomorrow itself, we will be uploading the videos of the presentation. So with that, we come to the end of the day. Thank you all. Good night. Once again, thank you, Muktinder sir. Thank you,
Thanks.
sir. It's over to Dr. Shaila to moderate the.
Bye-bye. Bye-bye.